Hello, doctors. I'm Dr. Rajiv Chawla, Senior Consultant Diabetologist and Director, North Delhi Diabetes Center. On this World Diabetes Day, I feel it is my duty to share that India has dubious distinction being world capital of diabetes. We already have close to 75 million diabetes patients and an equal number of pre-diabetes patients, those who are likely to get converted to type 2 diabetes over next 5 to 10 years. So this situation is very, very alarming for all of us as healthcare providers and medical fraternity, because we are at a very great risk for developing micro and macrovascular complication during the course of the disease. Higher are the number of patients living with diabetes, greater is going to be the burden for developing micro and macrovascular complications. We know microvascular complications start only after the onset of the disease. And since then, they follow a linear course in terms of duration. So if you have a poor glycemic control lasting for 5, 7, 10 years, obviously you are at a greater risk for developing diabetic nephropathy, diabetic retinopathy, and peripheral neuropathy. But unfortunately, macrovascular complication like risk of cardiovascular disease, stroke, TIA, peripheral vascular disease, diabetic foot, gangrene, or myocardial infarction and heart failure. These are macrovascular complications which can come even before the onset of the disease. Many times, you might have certain microvascular complication right at the time of diagnosis. And this is what is known as ticking clock hypothesis. That means this risk for developing cardiovascular disease or macrovascular complication for that matter is there even before the onset of the disease. So very fact, if you have a poor glycemic control after the onset of the disease, obviously this macrovascular risk also keeps worsening. As I just said, microvascular complication will go with a linear relationship with the disease duration. So if you don't have a very long-standing diabetes and your control has been very good, something like 6.5, the risk for microvascular complication is very less. But macrovascular complication risk needs to be identified right at the time of diagnosis by doing a lipid profile, by doing a baseline ECG, looking for blood vessels, peripheral vessels into the feet, so that if patient has any of these risk factors or hypertension and dyslipidemia, then we must start treatment right at the time of diagnosis so as to check the progression of macrovascular risk in these patients. And we know type 2 diabetes patients are 3 to 4 times at a greater risk for all macrovascular complication, cardiovascular disease, and cardiovascular mortality. So it is not only important to have a very tight glycemic control, but also it is important to have address all the other risk factors which are there at the time of diagnosis, like dyslipidemia, hypertension, or if patient is a smoker or has a strong family history of diabetes or cardiovascular disease in the family, we need to not only start statin, we need to start ACE, ARBs, many times if required, a low dose aspirin also. And yearly, this should be assessed again and again so that anytime patient, if manifests with any symptoms, all these risk factors can be controlled, can be addressed to, so as to check the progression of macrovascular risk. Because I told you, even in microangiopathy or microvascular disease, the cause of mortality most of the time happens to be cardiovascular disease. So it is very, very important to address all cardiovascular risk factors in the setting of type 2 diabetes. So my final message to everyone is, we must screen patient much early in the course of the disease. We must look for all micro and macrovascular risk factors right at the time of diagnosis and yearly, every year after year. And if patient has these multiple risk factors, not only a diet is very, very important, not only a regular exercise of 45 minutes is very, very important. Most of the patient will require statins or ACE or ARB and other suitable drugs to reduce cardiovascular disease in these patients. Thank you very much.